Good morning, venture capital. This is Metagame, and today's episode is about the dramatic split shaking up healthcare investing, where biotech startups are riding a massive wave of funding while the rest of the sector faces a sobering downturn. Healthcare just split in two, and if you're still treating it like one market, you're about to learn an expensive lesson. Here's what happened last quarter. Biotechnology deals climbed 8.7%. Solid, respectable, the kind of growth that makes LPs nod approvingly. Meanwhile, other healthcare, that catch-all bucket of digital health platforms, telehealth darlings, and healthcare SaaS, dropped 39%. Not 3.9, 39. That's not a correction. That's a category getting repriced into irrelevance while everyone was busy arguing about AI valuations. So why is capital flooding into molecules while fleeing from software? Because the market finally remembered something it forgot during the ZERP fever dream. Regulatory moats aren't a nice-to-have. They're the entire game. Let's get into the numbers, because this is where it gets interesting. Biotech posted 50 deals in Q4, up from 46 the quarter before. That 8.7% jump happened while overall venture activity slowed. Translation, capital is concentrating into fewer, higher conviction bets. And biotech is winning that competition. The money raised? $2.4 billion. The top deals tell you everything. Grail pulled in $325 million, Galecto secured $285 million, Odyssey Therapeutics locked up $214 million. These aren't spray and pray seed rounds. This is growth equity and crossover capital, betting on near-term catalysts, phase 2 readouts, FDA designations, partnership announcements. Now flip to other healthcare. Q3 had 61 deals, Q4 37. That 39% collapse represents one of the sharpest sectoral pullbacks in the entire SEC dataset. What lives in this bucket? Digital health platforms, care delivery services, telehealth, wellness tech, basically anything that got overvalued on COVID tailwinds and is now getting re-rated as growth stalls and enterprise buyers cut budgets. The question VCs are asking these companies is tough but fair. Do you have a regulatory moat? Is there a strategic acquirer? Can you reach break-even without another equity round? For most of these plays, the answer is no, no, and no. Compare that to biotech, where a phase 2 success can trigger a $500 million acquisition overnight. Digital health has no equivalent forcing function. The exit market reflects it. The IPO window for healthcare SaaS has been frozen since late 2021, and it's not thawing anytime soon. But here's where the story gets richer. Pharmaceuticals, the quiet middle child nobody talks about, posted 20% deal count growth. 24 deals, $1.7 billion in capital. This cohort includes specialty pharma, reformulations, orphan drug programs. Lower technical risk than early-stage biotech, but way higher strategic value than digital health. Real drugs, real reimbursement, real FDA approvals. Orphan drug designations hit record levels recently, and that's driving investor interest. Smaller total addressable markets, but faster paths to approval, premium pricing, and 7 years of market exclusivity. So what's driving biotech's resilience? 3 forces converging at once. First, the FDA signaled flexible CMC oversight for cell and gene therapies in January. For the uninitiated, CMC is chemistry, manufacturing, and controls. The regulatory friction that can add years to commercialization timelines. The FDA just turned down the heat. When the biggest variable investors underwrite gets easier, capital flows. Building a new product? Temez Labs takes you from napkin sketch to the App Store. Trusted by Fortune 500s for quality, security, and speed. Book your free strategy session at temez.ai. Second, strategic M&A demand is spiking. Nearly $180 billion of annual pharma revenue faces patent expiration by 2027 and 2028. Humira, Keytruda, Eliquis. The blockbusters are going generic, and big pharma needs to replace that revenue. Where do you think they're looking? Biotech acquisitions. That creates a valuation floor and clearer exit paths, even if IPO windows stay shut. Third, ecosystem infrastructure matters more than ever. Boston and SF aren't just biotech hubs by accident. They have 40-plus years of specialized infrastructure. Lab Central in Cambridge just launched a program offering 6 months of free lab space to 18 first-time founders. That's ecosystem scaffolding designed to keep company formation alive in a tighter funding market. Digital health has no equivalent support system. Now let me connect this to the AI story because everyone wants to know where AI fits. Healthcare is where AI's $202 billion global deployment meets tangible ROI constraints, and only a narrow slice of healthcare AI is actually getting funded. Converge Bio just raised an oversubscribed $25 million Series A from Bessemer for AI-driven drug discovery. They're using generative AI trained on protein sequences to accelerate antibody design. That's AI inside R&D budgets, not IT budgets. Pharma will pay 7 to 8 figures for tools that compress timelines or improve phase 1 success rates because the downstream economics justify it. A blockbuster drug generates $1 billion plus in annual revenue. The math works. Compare that to AI-powered care coordination platforms, which struggle to prove ROI to hospital CFOs and get cut in the first budget cycle. If your healthcare AI can't cite a CPT code or a phase 2 endpoint, it's not healthcare. It's just SaaS wearing a stethoscope. The enterprise AI adoption curve favors healthcare categories with clear economic buyers and binary outcomes. Biotech has both. Digital health has neither. That's why AI is amplifying the biotech digital health divergence, not bridging it. So what does this mean for how you allocate capital? If your healthcare portfolio tilts toward digital health, telehealth, or care delivery services, you're on the wrong side of that 39% collapse. The market is demanding regulatory moats and strategic exit paths. Does your portfolio have FDA approvals, patent estates, orphan drug designations, or is it selling software to hospital systems with 18-month sales cycles? Are you positioned for the patent cliff M&A wave? Big Pharma will deploy 50 to 100 billion in biotech acquisitions over the next 24 months. That's a once-a-decade exit window. Are your biotech companies at the right stage to capture that bid? Phase 1, complete, clear differentiation, partnership optionality, or are they still 3+ years from an IND filing? And here's one people don't like to hear. Geography isn't a detail, it's the entire competitive advantage. Boston and SF captured the overwhelming majority of top biotech rounds. If you're trying to build biotech portfolios from Austin or Miami, you're fighting uphill against talent density, CRO access, and Series A fund concentration.
Oh, hey, friend. Do you like what you're hearing? Now you can have a ridiculously amazing podcast, too. Check out holler.studio to get yourself one today.
The emerging opportunities are clear if you're paying attention. Specialty pharma roll-ups targeting orphan drugs offer lower risk than pure biotech with higher returns than healthcare IT. AI in clinical trials, infrastructure, site selection, patient recruitment, data cleaning sells into biotech R&D budgets at 7-figure ACV contracts. And the smartest allocators are running barbell strategies. High risk, high return early stage biotech on one end, cash flow positive specialty pharma on the other. The middle, digital health without regulatory moats, services without margin leverage, that's where capital goes to struggle. Digital health promised software margins. Biotech delivers FDA approvals and $500 million exits. The market has spoken. Remember that 39% collapse in other healthcare? That's not a tough quarter. That's a permanent repricing. The companies that raised at $200 million valuations in 2021 are now doing inside rounds or shutting down entirely. Meanwhile, biotech keeps climbing because it has something digital health never did, a forcing function. FDA milestones create binary events. Patent cliffs create urgent buyers. Regulatory moats create defensibility. Healthcare didn't just have a divergent quarter, it revealed what was always true. In a risk-off environment, the market pays for science with regulatory protection and strategic exit paths. Everything else is innovation theater. The $180 billion patent cliff is coming. The FDA just accelerated CGT timelines. Boston and SF are doubling down on ecosystem support. The question isn't whether biotech will keep winning, it's whether you're positioned to capture the returns when it does. Healthcare split in two. Which side are you on? That's our venture capital podcast for today. If you learned something new, tap 5 stars and follow our show. Thank you for listening to Metagame.
Grep News. Thomas.